clarify how physicians should be guided using these guidelines? Does the absence of a recommendation mean that, let's say, a certain probiotic strain cannot be used?
Yeah. There were two conditions, two situations. One is absence of evidence, which means there is no studies which looked at this particular condition and for the use of probiotics. So no studies, it's clearly we cannot say anything. But there is another situation, we have no recommendation for or against. And what does it mean? That we identified certain number of randomized controlled trials with various probiotics. For in our guidelines, we needed at least 2 randomized controlled trials in order to formulate any kind of recommendation. But still, we concluded no recommendation for or against. What does it mean? No recommendation for or against means that different options will be available for different patients, and that clinicians should or could help patients or the parents in our situation as pediatricians to make decisions consistent with their preference and their values. Clinicians should know what is the effect size, what to expect, and then to explain it to the parents and to ask them whether or not this is something that it will be for them sufficient. For example, reduction in the duration of crying time, 20 minutes or something. Are you satisfied? And it may be such an effect, maybe not. So once again, no recommendation for or against means that clinicians should help patients to make their decisions whether or not. We do not have enough evidence to say one direction or another direction.
So when you say there's not enough evidence, it also means that there's need for more studies.
Definitely. I would say even in the situations when we have positive recommendations, we still every now and then need some more studies, but this is definitely the conditions that we will need more studies. So, and this is the formulation, no recommendation for or against, an interpretation of it. It's really with all the guidelines, how to develop guidelines.